Today's video answers the question, my dog has developed really bad anxiety and severe phobias of noise, people and strange objects. It's getting worse. What should I do? So this owner rehomed a young large breed dog, and one morning there was a vehicle accident that they witnessed. There was lots of noise, there was sirens, and the dog became really traumatized by that event. And ever since then the dog has just panicked when they've come near something that just really isn't a threat at all. It's a strange object, or when there's been a strange noise. And in one incident, this dog actually kind of leapt over a bin. They dragged their owner into it. It really injured them. And then they ran off home down the street, pulling their retractable lead behind them, which was banging on the ground and causing even more problems. And ever since then, the dog has just seemed to be hyper vigilant, is always on edge, is massively anxious, and the owner's just terrified that it's going to happen again, that it's going to cause them a personal injury and also death of their dog potentially. You know, if a dog panics and runs off like that, then running across the road is the last thing they're going to be worried about, and that can definitely cause some really nasty problems. So the owner has consulted some trainers and they've advised a prong collar, anti-anxiety medication, and of course a modified training program. So the first thing that I would say is that I'm not a dog trainer, but I'd absolutely advise against a prong collar, a choker chain, a shock collar, or any other form of training that involves negative feedback or punishment. And that's in any dog, but let alone a dog with severe anxiety and high stress levels. Just imagine what being punished is going to do to that dog. They're going to actually develop a phobia and a fear of you, I would have thought, or they're just going to be even more anxious. So that would be my first comment. Now, with problems as severe as you're describing, then to give you the best chance of a successful outcome, you really need to be thinking about working with a certified veterinary animal behaviorist, if that's at all possible in the area that you are. Now, they're kind of quite few and far between, but they will travel in a lot of cases, or it might be a case of you needing to travel to see them. But if it's at all possible, seeing a certified veterinary animal behaviorist is definitely the best option, and for them coming up with a treatment plan that's suitable for your dog and your home situation. That being said, some first aid steps that I could think you should consider would be not to walk him by yourself if you're not strong enough to control him, especially when he's panicking. So he's a really big dog, really strong, so you need to be really strong as well. And you know, to be honest, some of these really large breeds, if they want to go, they will go no matter who you are and no matter how strong you are. So really think twice about walking them by yourself. If necessary, walk them with a friend. Both of you have hold of a lead, and that way you're more likely to be able to control him. Also use a harness and a short lead. So retractable leads are seldom a good idea. The mechanism might fail, or you'll suddenly try and stop your dog when they're running out, and they'll just yank it out of your hand. So I definitely don't recommend retractable leads anyway. Harnesses also allow better control rather than just a collar around the neck, and then use a short sturdy lead with a really sturdy clip to make sure that nothing breaks. You also want to avoid anything that acts as a trigger, so you really need to set your dog up for success rather than failure. And when we've got phobia, when we've got an anxiety, for every negative experience it makes that behavior more ingrained. So we want to try and avoid that if at all possible, and like I say, you know, set your dog up for success. And then lastly, definitely talk to your vet as soon as possible, especially if there's going to be any delay in seeing a veterinary behaviorist, to see what suitable drugs are available for your dog in the short term. Now, there are supplements, and some of those might be Carmex, Zilkine, and also an Adaptil collar, so that's a pheromone collar. And while they may help, and they definitely do help in more mild anxieties and you know, more mild, say, sound, not necessarily phobias, but just sensitivities. When you've got a really bad phobia and when you've got really severe behavioural problems, they may help a tiny bit, but they're not going to be the be-all and end-all. So at least in the short term, you should definitely talk to your vets and see what other stronger pharmaceutical drugs are available and suitable for your pet. And then finally, with behavioural problems, and this goes for any behavioural problem, don't ignore it. Behavioural problems only get worse. So great job for asking for help. Follow that through. Unfortunately, behavioural problems, there's seldom a quick fix, but if you get onto it sooner, then it's going to be easier to control and to potentially reverse. So definitely get in touch with that behaviourist.